I chose UCSD because I wanted to go somewhere that had a mix of a kind of county hospital or urban experience and then also a university experience.
I love the faculty at UCSD. I find them extremely dedicated and extremely approachable.
There's always someone to talk to and always someone to run your ideas across. I think that's what makes UCSD special.
I really liked all the different specialties that we get to experience while we're here, like talks and hyperbarics and wilderness, and we get a lot of time to explore all of those different options.
I think it's tough to find another program that has the variety of experience that we do here, plus the beaches and the awesome climate in San Diego. It's pretty tough to beat.
And it's a very busy emergency room as well. There's never really a time where you're just kind of sitting there waiting for lab results. You're constantly moving the entire time you're on shift.
Sometimes it can get pretty crazy here, and I think we have patients in Hillcrest, San Diego that are pretty unique in the country, and we see a certain demographic that many other residencies don't see.
I love the people who work at Hillcrest. I love working with the consultants. I love our social workers and our case managers.
See patients here who haven't seen a doctor in years and have lack of access to health care, and a large homeless population here in San Diego, as well as a lot of tourists here on vacation. So you kind of get the whole spectrum of patient population. It's a very wide breadth of patients here.
Every time I go to La Jolla, I learn something new. There are very unique patients, very unique diseases there. You interact a lot with their specialists.
The La Jolla site has some really complex medical problems that are really unusual and kind of make you think, as well as the breadth of specialties available there. You also work really closely with your attendings one-on-one. It's less sort of resident-driven, so you do get a little bit of a different experience there.
I think SIM's fun. I think it's a good way to go through cases that you wouldn't see every day and to practice procedures. Our attendings that lead SIM are awesome. It's always a fun experience kind of with your co-residents. And later on during residency, you have an opportunity to be involved in teaching and kind of leading cases at the SIM Center.
It's San Diego's only children's hospital, so any pediatric emergencies really kind of get funneled into Rady's Children's Hospital. It's a very good blend of medical and surgical emergencies that come in.
It's nice to have that dedicated time to see kids and interact with the faculty there. And you see a lot of pediatricians as well that also practice in the emergency department, so you get an idea of what goes on in the inpatient setting of dedicated pediatric hospitals, and then you get a chance to be a part of that from the first time they step into the ER.
El Centro Regional Medical Center is located about 2 hours east of San Diego. It's a little bit of a drive to get out there, but it's actually a really pretty drive, in my opinion. It's really the main community hospital in the area. But right next to the hospital, our residents actually have an apartment complex and a house itself that we get to stay in, so we don't actually have to use our own funds to stay out there for the 2 weeks that we do for OBGYN or when we're out there working in the emergency department.
You see all sorts of people who maybe haven't seen doctors in a while. without very little specialist backup. So you get to make a lot of important decisions. You get to kind of test out your skills.
I think El Centro is definitely one of the best parts of our program. You spend a couple weeks there as a second year. You get chest tubes, you get trauma, you get intubations. You're usually the only resident out there, so you get the pick of all the sickest patients. We do OB out there, which I thought was actually pretty fun because you're just there for deliveries.
As a second year, you're actually running the ED. We'll get to do things that other places probably don't get to do, like we don't have neurosurgery on board. So one of the residents a couple years ago actually had to do a burr hole to transport a patient with an intracranial hemorrhage. So it's really interesting, and everyone's really grateful.
Mercy Air is a really unique experience that we get to do as residents here at UCSD. In the nation, I think there's only about 16% of residencies that actually allow residents to fly on helicopters. UC San Diego is unique in that it actually allows us to be primary in control of the patient. So you're not actually riding along on the flight crew, you're actually in charge of making decisions, performing some of the main procedures that take place. For instance, I've had a unique opportunity to do field intubations where I've actually had to intubate a patient in the middle of essentially a farm field.
You get a better appreciation for what the EMS personnel and the medics have to deal with, and kind of get a better appreciation for what it means to transport your patient, you know, how people can decompensate in flight. And a lot of us have had really cool stories and experiences that you wouldn't have if you weren't flying with Mercy Air.
Everybody's on a first name basis, it's all friends, family, they all know each other's spouses and kids, and yeah, I think I look up to a lot of the people here at the program like they're my own family.
I think San Diego itself really provides a lot of opportunities to interact with your residents outside of the emergency room. We have a lot of program-sponsored events, but there's also a lot of opportunities outside to go to the beach, to go have a bonfire down at the beach, to go surfing with a bunch of co-residents. The food scene, the nightlife, everything in San Diego kind of feeds itself into a really good social experience here in San Diego.
My favorite thing to do with my co-residents is go surfing by far. We definitely take the boards out, paddle out, and spend some time out in the ocean and get immersed in nature and everything. It's a lot of fun.
So I can honestly say some of the best friends that I've made have been some of my co-residents and some of the residents above and below me at UCSD.
I think you can find any type of group or any type of person, activity that you want to here at UCSD. And I think the weather, the ability to go outside is pretty suitable for any person who wants to do emergency medicine. So I think whatever you want to do outside of work, you have the opportunity to do here in San Diego.
One of the reasons I chose to go here is everyone feels like a family, and I feel like no matter what you want to do, there's a lot of support. So if you are interested in hyperbarics, you're interested in toxicology, there's a faculty member that will help you, kind of take you under their wing and mentor you and help you get into the, figure out what you're interested in and get involved in that.
I would say to pick a program where you feel you fit in the best and that you think is going to be your family, because at the end of the day, you're going to spend a lot of time in residency in the hospital, and you're going to spend the majority of your life with these people, and they're going to be some of the most memorable, hard years of your life. But if you're with the right people, then it's all going to be just fine.
You should definitely come to UCSD. I have never regretted my decision. First of all, you get to live and train in beautiful California. But on top of that, you get an amazing training experience with multiple clinical sites, amazing faculty, and you will make lifelong friends here and come out a great ER doctor.